Which is the best Medicare supplement policy? I get asked this question all the time, and I think the best way for me to explain this to you is we're going to look at this chart and we're going to talk about this. So before we get into this chart, remember how a Medicare supplement policy works, what their role is. Medicare is your insurer. They're your primary insurer. The supplement is a secondary payer. So let's say you go and you get an MRI, and that's a Part B bill. It's submitted to the Centers for Medicare and Medicaid Services. They're going to process the claim. Was it medically necessary? And if they approve it, then they're going to pay their portion. We know Medicare is not designed to cover every dollar, and as a result, you get a Medicare supplement policy to fill in some of the dollar gaps. So here are all the possible dollar gaps, and then when you look at F, G, and N, you can see that they each cover the gaps a little bit differently, but also very in a similar way. So what's going to happen is that if you choose Plan F, they're on the hook to pay something. If you choose Plan G, the insurance company is on the hook, and if you choose Plan N, they're on the hook. So it's not about whether or not they have to pay on the claim. The question is how much. So what's going to happen is that we know F covers every possible dollar gap. F is going to be a little bit more upfront in the cost and the premium. G is very similar to F, but there is one difference right here, and the premium is going to be a little less. And then if you look at N, N has some more differences, and the premium is going to be less. So the question is, do you want to pay more upfront for like a plan like F, which again, most people can't get F anymore unless you had Medicare before January 1st of 2020. But there's a lot of you still in F, and you can remain in F. But the point being is that if you have a plan that covers every dollar gap, you're paying more premium. You don't participate in the cost of the gaps. If you're in G, you're going to cover almost all of them except for the $240 deductible. And if you're in N, you're going to pay less premium, but you're going to help cost share a little bit more. So which is best? They all have to pay on the same claims. They've already been approved by their boss Medicare, but the difference is whether or not you're contributing to the cost, and depending on which plan you are in, determines how much premium you're paying. The most here, the second most here, and the third most here. Hopefully that helps you understand. So what is best depends on how you're trying to get your coverage set up.